Hello. So for this week's journal assignment, I will be discussing a patient encounter that I recently had with my preceptor. With this particular encounter, it was for an adolescent, and the young man was 13 years old. His mother, no, I'm sorry, his grandmother was raising him, and his parents weren't present in his life at the time. He's in school and he has a lot of different behaviors in school. This was actually his second visit with the nurse practitioner. He had been having a lot of behaviors where he was disrespectful to the teachers. He had been physically abusive with some of the peers in his class. The reason why I say abuse is because these kids weren't defending themselves. He was just fighting on kids that wouldn't fight back. And he had been threatened with suspension. He had a lot of physical aggression, and he also was very inattentive in school and doing bad with his grades. I think the reason that this particular encounter stuck out to me is because the grandmother felt that her grandson was the way that he was because of his parents leaving him so young. His father had passed and his mom was on drugs and wasn't present in his life. And even though that probably did have a lot to do with some of his behaviors, she to me seemed to use him more as an excuse, and she didn't want him to get any type of help with medication. Not saying that medication is always the answer, because parents do have a right with their children to make that decision, but I do feel that sometimes, depending on how severe things become, if you see that other forms of treatment are beneficial, I do feel that it's selfish to only consider your child or grandchild versus those that are also being affected. Not only were the students having a hard time in class because the child was being so abusive to them, but the teachers also had issues with conducting class and able to teach the other children. The nurse practitioner that I work with now, doing my clinical hours with, she did provide other forms of help for him, some behavior therapy and some other types of therapy that he could utilize to help him with his behaviors. And the grandmother was okay with that, but she had also been offered that type of assistance on the last visit and hadn't started it yet. So to me, it was kind of, I would say, my weakness in this area, not weakness with what the grandparent seen or the child seen, because of course I was professional during the visit, but the part that I guess upsets me is that you come to a nurse practitioner because you feel that there's a problem and because you do want help. But when the help is offered, you're denying all forms of treatment. I think the nurse practitioner role is very important with this specific patient, as well as others, because she is offering different forms of treatment for the grandparent that doesn't want to do medication. Yes, I do understand a lot of people do have, biases against medicine, and that's okay. But I do feel that you do have to also be open to doing something to help a child if you want them to be the best that they can be. So I think that was kind of my weakness with this issue, just being upset about how the grandparent to me wasn't doing enough. I do think that the role of the nurse practitioner is very significant, because not only is she providing different forms of treatment for him, but she's also keeping a very, very good poker face and being very empathetic. Even though she does know that the child has a lot of issues and problems, she's still at all times, so what is it that we can do? Exactly what's going on? What do you think this derives from? Her focus is always on making him better. Like I said, my issue was the grandparent not being empathetic for the other people that are being affected by his behaviors. When it comes to including my reflection on my therapeutic use of self, I think I did very good using myself during this visit, because I did speak with not only the child but also the grandparent, and I asked her what did she felt like was helpful for the young man, and what helped him, what calmed him down, and what things that she felt were positive coping skills for him. She did name many. One was playing with his cars. He liked playing with cars, but I was trying to figure out things that he could possibly do in school or when he's in other settings that could help. And she didn't have much to say. And once again, we went back to, what do you think that you're going to consider letting him do the different forms of therapy that are being offered, because you're not, open to medication. My discussion on my reflection, learning, insight, I learned that no matter what, you got to stay positive. You have to always be open and listen to the parent as well as the child. And you also have to try to understand them the best you can. For me, that is kind of hard in this situation, but I know that's what we have to do in this role. So I'm just trying to understand why the grandmother doesn't want help, but reaching out for help. That's the part confusing me. Not that she doesn't want him to get medicine, but the fact that you're asking for help, but you're not seeming to try to use the help that you're being offered. So that's why it was a little hard for me. I do feel like I learned, like I said, the nurse practitioner, I think she does great. She's always very professional. No matter what, you can tell she's feeling on the inside, because she even, voices that to me after the visits. She continues to stay professional and let the parent as well as the child feel that she's 100% there for them and trying to assist them and make them the best that they can be, because that is our ultimate job. I do plan to use a lot of this information I've learned from her in the future and when I interact with my patients in the future, because like I said, she's great at always being open to listening. Even though she doesn't understand, she acts as if she understands, which is kind of sometimes can be a little upsetting, because it's like, well, maybe they feel that what they're doing is okay because you're understanding. Sometimes a little constructive criticism is okay, even as a nurse practitioner. That's one thing I have seen her do with a lot of different other patients, but I haven't seen yet with this particular patient. I think it's coming though, because she did say when it was over that if the grandparent is continuing to not do anything that's being offered, then there's kind of no point of her continuing to see the patient. But at the same time, she doesn't want to feel like she's neglecting him, because she wants to give her a chance to maybe eventually, be more open. That's about it. I answered the questions from the journal. Like I said, to me, it hits a soft spot because I'm always considering others, and I'm thinking about the fact that he's going to continue to go to school and pick on kids and bully kids and abuse kids, because the grandparent who thinks the parents failed him is also, in my eyes, failing him by not getting him the help that he needs. But that's about it. Thank you.